All right. So just a couple things coming down the track that I kind of want to make sure everybody knows. Starting Monday, or actually starting Sunday, everybody remember the ADP is coming down the track. So you'll see new time clocks if you're on call. Even Saturday night, remember this, if you happen to come out in the wee hours of the morning, just write it down for us, okay? So if there's any question about it, even Saturday, if there's any question or what have you, write it down for us, let us put it in, okay? But Sunday for sure, if you're on call, write it down. We will take care of getting it put in for you. When you come in Monday, you should be able to clock just like normal, okay? Everybody should see laying around, we've had some stuff to where you can put the ADP app on your phone. If you have any questions or concerns with it, let us know. So keep in mind, we have a couple different places that you can do HR stuff now. When that goes live, you're gonna have everything that's going to integrate into that one spot. You're gonna be able to find your pay stubs, you're gonna be able to do your deductions, you're gonna be able to do every bit of that, your time, all right there out of that one place, okay? So I know there's a little learning curve.
You can go do a payroll calculator, like, if I only work 56 hours this paycheck, how much will my check be? And it'll tell you how much check it was.
So it's pretty neat. So you can kind of migrate around in it. If you need some help getting the app on your phone, make sure you let us know. We have a couple of good, smart folks that's already got them on there. I'll refer you to. No, I'm just teasing. No, I'm teasing. All right. So we got ADP. We talked about that. So also, everybody's been working on going to the pumps. The Baxter pumps go live Monday. Okay, they said 9 a.m. So we have enough that's allocated to us for every room. One of the things Anesthesia had asked for, which I think is a great idea, that we set room 4 up, like I know that's our trauma room, like when you come in at night, or at any point in time, that they also have a carrier that you can put 3 pumps on it. So we'll set that room up and keep it set up like we do now with all the trauma stuff in it, and we'll make sure that there's 3 pumps in there for that room, okay? So, but that will go live Monday too. All the Baxter stuff and the anesthesia will have new syringe pumps. There's also supposed to be a syringe pump for every room allocated. So if we're looking for something, or we need something, or we realize we don't have enough, just make sure, let me know, okay? I'm gonna try to get them all out and about, but just make sure if we don't see that there's enough of them, just reach out to me so I can make sure we get enough, okay? But I do know that was enough of all of that was allocated to us. All right, so we got pumps. And then the other thing that's gonna go live Monday, and it really is not affecting a whole lot right this very minute, but it's gonna be the TDOC instrument system, okay? So you're gonna see some people here. We're just gonna be learning how to use the system. They're gonna call it Go Live because the system will be up and running. The system is designed, once we go to Epic, or that's the reason we bought it. You can follow it through the system in this, but we're not gonna learn 2 different ways. When we go to Epic, what it will do is integrate into Epic, and it closes the circle where the instrument started to where they finished, all the way back to the starting point again, okay? So as we scan those trays and stuff like that, as the guys show you, you'll get some training on it next week. You'll get a little bit here, you're gonna get a little bit more there when we get closer to Epic, okay? But it'll kind of show you that, but that's what that whole system is designed for, is to close that loop on the instrumentation stuff, okay? All right, so that's coming Monday. So there's lots and lots of things coming live on Monday, all right? So one of the things, and I should have really started off with this, something that's pretty impressive. So as of today, we'll have finished with 194 cases for this month today. We are at 80% on-time starts. That's pretty awesome.
It's awesome.
But what's even more awesome is the reasons for the delays. It's little sporadic stuff. It's things like the patients arrive late. You know, you're gonna have there's so many moving parts to us. You're gonna have little things like that. There's no trends to it, other than every now and then we got some patients that don't arrive on time. I laughed. I told her I was going to ask who wanted to ride the short bus to go round everybody up in the morning time and be the driver. I'm just playing. But with that said, that's awesome. That is absolutely awesome that it's down to, I call it nickel and diamond. We're always going to have that. But I'd rather it be that there's nothing consistent. All the little kinks of our mornings seem to be getting a little bit better, getting kind of worked out, having the things that we need, all those kinds of things, people getting here, all that kind of good stuff. So I was just gonna say kudos, that's awesome, y'all. I mean, I just think that's superb. Our turnover, everybody's rocking and rolling on all that kind of good stuff. I mean, we're really seem to be getting into a good system, getting the morning started, turning the cases over. Y'all, you're doing a great job. Thank you. And those numbers just continue to get better and better over time. And as our cases get better and better, as we're doing more cases, we kind of see what's even more impressive. As we're doing more cases, the numbers are getting better. That's what's impressive. So keep up the good work. What you're doing is working, okay? And also next week, all the evals are done. Everybody will we'll get them all signed, okay? So don't worry about that. That's just going to be taking next week. We'll get them all signed. And then the one thing that we've been kind of pondering over that I know has been kind of a touchy subject is the late day. Let's kind of talk about that. Let's kind of air out how we want that to work, how we need that to work. So the late day person needs to be that person that's going to stay late to help facilitate the schedule, but once we're gone, they don't have to come back, right? So, like even in the afternoons, you've got the late crew, all right? If we see that it's a big enough schedule that they're going to get stuck, then we need to also facilitate trying to get them out, okay? Because it's one thing if it's a time here or a time there, but no one wants that to be a consistent thing, okay? So, but that's what we want that person to be. We want that person to help facilitate the afternoon, okay? That person it's not staying over the call person by no means, because I kind of heard little bits and pieces of different things. But that person is to help facilitate the afternoon, help get the cases done. And then when we get to a point that we have it down to where it's handled by the call team, then that person goes home and they don't, of course, at that point, everybody knows they have no obligation. I know, you know what I'm saying. So, unfortunately, we've had a time or two in the was it last week? You know, we had one day that was it was just crazy. It was completely out of any kind of normal that we normally have, okay? But we kind of want to work through those so that we kind of know what to expect, okay? Is there any issue? Does anybody have any problem with that? What we expect out of that late person? But I will tell you on those days, we've had several people who have stayed late, several people who volunteered, teams that have volunteered, and thank you. I mean, that's very much appreciated. Even just like yesterday, it was amazing what 1 hour, we ran 1 hour of extra anesthesia and having enough people to run to 4:30, and we had 8 cases going at 3 o'clock. By 5 o'clock, every bit of that was done. 5:15, something like that. It was all done. That's what I was going to say. I mean, it was completely done by everybody kind of wandering, pushing together at that push time to try to get them done so we can get everybody out here. Okay. And then, does anybody have anything before I go into my next what I need to talk about? Is there any questions, any concerns with any of that? Because just know, if there are, please just, if you have any questions or concerns, either come to my office, ask me. Everybody knows my door is open. Please know that. Okay?
I do have, it has nothing to do with what you talked about. But just remember, if you use a tourniquet, to not unplug it. They're 100 years old, the batteries are not good anymore. If you unplug it for a long period and then plug it back in, it's going to fail. It's gotta be plugged in a while, after it's been unplugged a while, for the battery to work well enough for you to use it.
Awesome.
So, I try to keep them plugged in, but I've just noticed lately, and I think people just don't know, the newer people, don't ever unplug the tourniquets.
Thank you.
And another thing, I need everybody to sign this sheet. We put Dr. Holofield's new doctor's instruments out, there's a bottom filter thing in it. And the company says you don't have to have this little plate in the bottom on any set. So if you get one and it doesn't have this, that doesn't mean it's not sterile, you
Okay.
know. So I just wanted everybody to sign off on this so I can put this up,
Okay,
you know.
thank you. Thank you. Anybody else got anything? Good points. And everybody seen my little black bin? It was, please don't put any trash in that.
What is that?
That is the medical waste, little bin. The pharmacy man said had points thing to pay me today. He asked if I would pass that around. I said, sure will. All right, I'm gonna flip this off.